right, we are live now on FB. For the last 20 years, 700,000 American lives have been lost due to drug overdose. Acupuncture can help, and this is our topic of discussion today. I am Amita from Nourish Talk, a platform for natural and holistic therapies. Presenting this topic, we have Dr. Chester Dickerson, a licensed acupuncturist, Acupuncture Detox Specialist, a NADA certified instructor, and a professor. Dr. Chester has also survived COVID-19. Welcome, Dr. Chester.
Hello. Yeah.
All right. So I'm going to go to the first slide, Dr. Chester. Unfortunately, Dr. Chester had Zoom issues connecting to Zoom, so he has connected over the phone. So we are on the first slide. And if you could talk about some of the overview of the statistics and the history.
Okay. On the first slide, the alarming statistics.
Yes. We are on the alarming statistics on the first slide.
Okay. Yeah. With number one, we'll start with number one. Over 130,000 deaths daily are due to overdose, and these overdoses are basically due to fentanyl, hydrocodone, heroin, and other opiates. Number two, over 20% misuse of opiates. 10% are diagnosed with an overdose due to the opiate that was prescribed by a doctor for chronic pain. It was not just something that was taken off the street from other people. Number three, on alcohol and drug addiction, it costs the economy over $600 billion a year. With the $600 billion, that includes healthcare, it includes the expenses for treatment and the run-ins with the criminal judicial system. And the study that was done on this states that half of that money is just due to fentanyl alone. For 30.5 million Americans over 12 used an illicit drug in the last year. This study was done in 2017. So we know that 30.5 million is now more than 10% of the population. Number five, 11.5 million. That's the difference between the number of the survey. They did a survey of respondents where they asked people who admitted to using a marijuana. In 2007, it was 14.5 million people. And in 2017, it was 26 million. The reason thinking of the decrease, the increase is due to the decrease of the laws in the states of in the United States where we've changed our laws where marijuana is legal. So that's why they are considering that to be an increase. 1 out of every 7 Americans struggle with a substance abuse disorder at some point in their lives. Next slide, please.
Yeah, so we're talking about the acupuncture history now.
Okay, yes. Acupuncture has been around for over 3,000 years. It depends on where you read your literature because some books say 2,000, some books say 5,000. So we just go accordingly. It was about 3,000 years. The whole NADA protocol was specific for addictions only. Is how it became out. It was for addictions for heroin and in the South Bronx, and it started in the early 1970s. And this was due to Dr. Wen from Hong Kong, a neurosurgeon, was doing. He was getting ready to do surgery on a patient. Now, all of his patients were addicts, and he was getting ready to do surgery on a patient. And as he used acupuncture, he put it in the lung point, which is one of the points that we use in our NADA protocol. And attached it to electricity, and his patient stated that there were no cravings and he had no withdrawal symptoms. So he had written 60 articles on this addiction with using the ear and acupuncture. And later on, there were more points added. So after this was done, he'd written about 60 articles. It'd gotten to the United States. So there was a huge donor who started a clinic out in San Francisco called the Haight-Ashbury Clinic, San Francisco, California. There was Houston Ashbury Free Clinic. And then there's in New York, in South Bronx, the Lincoln Hospital was owned by the city, so there was no donation to get this program started. And the differences between the two is one offered methadone, which was the Lincoln Recovery Center that was in the South Bronx of New York, and the one in San Francisco only offered acupuncture. And what they did with the Lincoln Center is they would tailor off the methadone on a daily basis, and then it went to acupuncture. But as they were doing this, they had done so much research on it that they survived, and the Haight-Ashbury Free Clinic did not survive because they had no peer review research to prove that their acupuncture was working. So it was given twice daily. As I mentioned, the methadone was decreased. And so Dr. Michael Smith, who is the founder of the NADA organization, just worked with a few other doctors. Then they did some functional MRIs and started just poking around to see what other points in the ear would work. And over the several years of research, they ended up coming up with a total of 5 points. It started out with just the lung point because of the research from Dr. Wen and using the electricity, but also Dr. Smith found out that without the electricity, and you just stimulate the point with the acupuncture needle itself, the responses and the outcomes were more positive and a lot quicker, and they were longer lasting.
All right, so now we are at the NADA Acu Detox treatment. You are a NADA certified instructor, so if you could start with this.
Okay, yeah, this is it's a very, very, very simple treatment form. It's done in frequent sessions, and it's also includes things such as a sleep mix tea, which is a tea that was designed by Dr. Smith, beads, which they can come in silver, gold, or titanium. The titanium ones you can leave in because those are the only ones you can leave in if you have an MRI, because it doesn't bother the MRI. But if you have if you send someone home with the beads, you are going to use the gold beads, because the gold is considered in Oriental medicine theory yin tonification. You want to tonify the body, because drugs happen to bring everything down. So we have to tonify everything to bring it back up. So the silver is usually not used for tonification, as the gold is. And the gold, they find out that you can just keep on the ear permanently. Well, not permanently, but you can tape it on there and it'll stay on for about 7 days. And the patient can actually go home and press on it himself to get the results that a needle would do if they just sat there for 45 minutes. It is done, usually it takes about 45 minutes for the session, and it's usually done in a group setting. However, that's what we're taught in the NADA protocol. I have done many addicts, and I have worked on people with just pain management who have not told me they were addicts. And I had used this protocol for pain management, and 6 months later, I've had patients tell me, "Thank you for doing this, because I no longer get street drugs, or I no longer do heroin anymore. I no longer abuse my opiates," and they completely get off of them. And not even knowing that they were even on any kind of medication at all. It's nonverbal, so you don't have to chit chat with your patient. And that's a good thing, because it's like you can bring them right in and not have to say anything, and you don't have to wait for the extended process of going through the assessment and the diagnosis. And if they come in inebriated, intoxicated, or high as can be, you can still do the treatment on the person. However, the outcome is not going to be as good as it with a they were not inebriated. It will still have an effect, and it will be a positive effect. It decreases the cravings or withdrawal symptoms, and the withdrawal symptoms, especially the restlessness and the insomnia and agitation, they have found in all the research that we've done, and actually in our clinical, just did ourselves, you will notice significantly that there's a decrease in those three areas: anxiety, insomnia, and agitation. A lot of people get nervous about doing the protocol when they go into the group setting. Even just being in there, and if they say they don't want to do it, just have them sit there and watch everybody else, and you can feel the energy in there. The patient will end up participating in the protocol itself. It facilitates relationships between self and others. So that's why they prefer it be done in a group setting than to be done individually, because we have a tendency as Western physicians to stigmatize. And they know that. Addicts know that. They feel ashamed about what they're doing. So if we do it in a group setting, we're all in there for the same purpose. So it makes the whole energy flow in the room a lot better. No one's stressed out, and then the relationships become positive for patient, provider, as well as patient and the other all the other patients that are in there. And let's see here. The benefit is immediate. Most people will go home and fall asleep. The effective, regardless of the level of their motivation, it helps them want to have the willingness to start their journey to recovery. And you can use it with any other modality, such as cognitive behavior therapy or medicine-assisted treatment programs, counseling, talk therapy. This, you have to remember, is not a standalone treatment. It has to be done through with someone going to AA meetings or NA meetings. As long as they have something else, another support or another modality of treatment, this will help increase the effectiveness of that treatment. It treats at the whole level area. It doesn't just treat the symptoms or just the syndrome. It treats the body as a whole. So that's why that's why this is the holistic medicine, because drugs destroy the body as a whole. It doesn't just destroy the person's emotions, or it doesn't just, doesn't just give these certain symptoms. It's treated, everybody is treated as a whole.
Okay, so moving on to the next one. We are going to talk about unique benefits in behavioral health settings.
It's effective for all types of addictions. So it could be a gambling addiction, a sex addiction, pornography, all of that. It is the same protocol for every addiction, has the kind of same outcome for every addiction. It was originally for detox for methadone, for heroin, but it was mainly, that's what it was designed for, was to get off the heroin in the South Bronx area. But now they have shown that you can use it. It has good efficacy and as a pre-treatment form of treatment for harm reduction, relapse prevention, and long-term recovery.
Okay, should I move on?
No, effective. Okay, when it's for effective or long continuum of care, that means you can use it for you can add it, you can integrate it into another treatment modality, including those using pharmaceuticals. It's accessible to everybody, so it's not gender related or age related or race related. And now there's a study that's being done in it was done in Germany, and it had finally been translated into English. And so one of the staff members at the NOD Association in Laramie, Wyoming, got a hold of someone in Florida, and so now they're doing research on neonatal addicts. So as soon as someone delivers, they start using this protocol on the infants that are born addicted. And so they use beads instead of the needles. So, and they have found the research and that has done very, very well with it. As I've already mentioned, it treats the whole person, nonverbal. On the nonverbal and non-performance, that most other programs that are used for addictions are completely the opposite of that. They are verbal, and they are performing. You have to do both. A lot of people don't like to do that, and that's why a lot of people that's why the recidivism is so high there. They feel like that they're being forced to do something. Give them the option of not doing it or doing it in that group setting, and by the end of the day, they'll want to do it. There are a few complications. It's non-addictive, and for simple, flexible, and inexpensive. Not only is it easy to integrate it into other modalities of treatment, it doesn't cost that much. The needles are cost. I can buy a box of 1,000 needles for $10. So with the needles and the cotton swabs and the other things, the tape or whatever, if you want to use beads or seeds, it's not good. It doesn't cost more than $2 a patient for real in reality. And Dr. Smith really didn't want his trainers, his ADS people. I trained people to become an ADS. But as an ADS, he did not want us to charge more than $20 a person because it's so inexpensive to treat to begin with.
Okay, moving on. It's again the benefits. Yeah.
Yeah. The next slide. It's effective across. And we did this. Have we done the benefits one?
Yeah. So now we are at the improves the treatment relationships and the treatment environment. The next one, continuing with the benefits of the behavioral health settings.
I've not seen that.
Okay. Well, it talks about improves treatment engagement, retention, and outcomes. It's safe, which you talked about earlier. Consistent.
Oh, yeah. It's consistent because it's the same. It's the same protocol. It's the same protocol.
Correct.
Yeah. Okay. Improves treatment relationships and the treatment environment. This is basically geared toward the staff people because they suggest that the staff person providing the treatment get a treatment on occasion because it reduces their stress their stress and anxiety level as well. So I suggest that they do it at least once a week. The hardest patients to treat are pregnancy, people who have comorbidities. They have other diseases like diabetes, hypertension, which is a good one for hypertension as well. Or they're violent people, or they are people who are stuck in the criminal justice system and you can't get to them. I started out when I did this, I used to work for an attorney who would lower the sentencing if they would come to me for an acupuncture treatment. Or I've worked with the judicial system where when they get out and they're on probation, they'll cut their probation back, providing they go to acupuncture for part of their probation. So with pregnancy, that's a iffy thing. If you use body points, you probably wouldn't want to do a pregnant woman. Air acupuncture does not affect pregnancy at all. You will not induce labor, so that's not a worry that people do worry about if they're using body points for other pathologies. Next slide.
Okay. All right. So we are now talking about the NADA ear protocol.
It is. Yeah, it's chosen based on Oriental medicine theory and clinical indication, pain sensitivity, and this is in what they call in Oriental medicine a yin tonification. So remember, I was stating that you want to tonify. It's a yin tonification. Yin is a sense of serenity. Yang is nothing but chaos. So the actual addict is his whole life is in chaos. and to get him to calm down, which is yin. That's why they call it Detoxification. It restores the inner calm. It balances the body energy, and once you can balance the energy of the body will learn to heal itself, and then this becomes, then they consider balance as a state of harmony. The 5 points that are used are called Shinmen: sympathetic, kidney, liver, and lung 2. There's a lung 1 and there's a lung 2. Lung 1 is basically we use as acupuncturists for any lung condition other than addiction. So if you have asthma or emphysema, you would use lung 1. For addictions, you would use lung 2. All 5 points are on the external ear. They're easily located, so you don't really have to memorize the ear anatomy. During my seminars, I show a picture of the ear and the major areas where you go in the ear for the acupuncture. All the points are in the inner part of the external ear, the darkest part, because yin is also dark, whereas yang is day. So that's another reason the whole thing stays out of yin. Using a clock analogy, Shinmen is 12 o'clock. Lung 2 is at 6, liver is at 3 on the left and is at 9 on the right. And the sympathetic is underneath the ridge at the upper outer part of your ear. And that's underneath. So that's another significance of yin, because it's under. Over is considered yang. Okay, next slide.
This is about Shen Men.
Shinmen. Shinmen is probably the strongest point in the ear. In fact, it is the point that is I use in every protocol, and we're kind of taught that in school to use Shinmen first, because Shinmen is the calming, restless. It makes people become very calm. It also takes all the other needles that you use in the ear, no matter what you're using them for, especially in addiction. It brings them all together and uses them all as in harmony. So it's good for calmness, reduction of nervousness, reduction of anxiety. It decreases depression, and it helps the person go within to start their recovery. They heal from within instead of from the outside, and you heal from the inside out. B and C, well, B is the location is, I would have to show you that's right there is the map. There's an ear. That is, if you look at that, it's called the triangular fossa. If you look at the circular thing itself, it kind of looks like a fish. And so where the dot is on the slide, it's like the fish eye. So if you could picture a fish, when you're looking at that, just kind of in your mind, put where you would think the eye would be, and that would be where you would put Shinmen. Its indication, I forgot to put the body level on the slide. The body level is, it decreases anxiety, nervousness, it produces calming effect, it alleviates pain, and it also reduces hypertension. So a lot of people who use cocaine and other stimulants have higher blood pressures than those who come in with opiates or heroin. And next slide.
So, okay.
Adverse
reactions.
Adverse reactions. The first one is called needle shock, or vagal. It's a vagal reflex, because our ear is innervated mainly by the vagus nerve. So this is also called hypotensive shock. You have to be really careful with this in the elderly, because when you insert needles in the body, the energy moves really, really fast and a lot. So you have to look for things such as pallor. Is their skin getting? Is their face, losing color? Are they mentioning dizziness or being lightheaded? Are they starting to sweat? Do they mention anything about being nausea? or do they just say, I don't feel well, or they faint? And that's basically what needle shock is. I've been doing acupuncture for 13 years, and it wasn't until about my 10th year that I had 2 patients that I had needle shock with, both in the same week, and they both had fainted. So when they faint, or they get close to fainting, put them down on the floor. Make sure you elevate their legs. Their reaction will go away quickly. The sweating will stop. The color come back to into their face. Then offer them something to drink. If they get cold, put a blanket on them. Do not give them another treatment as soon as they feel better until 24 hours later, because a lot of people feel like they have already had a treatment. Once you stick that needle in that point, you have stimulated that point. So if it falls out, it just falls out. Don't have them pick it up yourself. But the fact is that once you have touched that area, it has been stimulated. Hematomas. A lot of people they insist on wearing gloves when they do acupuncture with the ear, because the ear is highly vascular. OSHA does not require it. If you want to do it, they probably require it now because of COVID, but as in the past, you don't have to use gloves if you're worried about blood, especially because you don't bleed on the insertion. You're only going to bleed when you pull it out. So you don't have to worry about bleeding on the insertion. So when you pull out the needle, and a bruise will show up if there's going to be a hematoma. I prefer using Q-tips and putting the Q-tip on the actual hematoma for 30 to 60 seconds. However, NADA says that you can do that, or you can give a cotton ball to the patient and have the patient hold on to the cotton ball on their ear until it stops bleeding. I just figured that if I can see it myself and I can put the Q-tip on her, it's more precise. It gets closer to the point than a cotton ball does. Penetration of the ear, you have to worry about that because it's so easy to go from one side of the ear to the other side of the ear. A lot of times the patients don't know it when it happens, because the needles are that sharp. They come with a little guide tube in them. We don't use guide tubes in ear acupuncture. We only use guide tubes on body acupuncture. So you have to, when inserting the needle into the ear, do it with intent, and you have to insert in quickly and twist quickly. But if you go in too far, and this is usually the liver point that people that have a problem with, that they go in from one side and out the other side. It's just a lot easier. It's easier to push through than it is the rest of the ear. Infection. The thing with infection is, if they have an infection in their ear, or if they have a scar or a scab or something out of the ordinary of what we consider a normal, healthy ear, you're not going to want to needle it. Now, if they get an infection after they have a treatment, which is very, very rare. I don't know of anybody who's ever had an infection except one person. I did an asp needle, which these are auricular semi-permanent needles. I don't recommend these for NADA. I do use them in NADA when I work in a facility, but I don't use them for outpatient because these needles are in their ear for 7 days. Sometimes they fall out, and they usually fall out when they've done what they're supposed to do. Well, I had a patient pick his up off the floor and put it back in his ear and ended up with an ear infection. So if they get an infection, advise them to see their primary care provider and have it taken care of. Headache. Headache is usually caused if they tell you they have a headache after you insert the needles. It's because it's probably the sympathetic point. What I normally would do is I would pull back on it just a little and ask them again about their headache. And if they say it's gone, then you can go ahead and keep that point in. If the headache remains, remove the sympathetic point. And then I would, the next time around, for probably 2 or 3 treatments around, I would skip the sympathetic point, or I would do less needles. You want to do at least 3 needles per ear. So if you do less, or you just take out the sympathetic, it will decrease the amount of energy, and then it won't have the patient won't have that much of a headache. I've only had that happen a couple times with a headache. And if you do take out the sympathetic point, the headache practically goes away immediately. Next slide. This slide, sleep tea mix. This is was designed originally for alcohol addiction. It was designed by Dr. Michael Smith, who was the co-founder of the NADA Foundation, and it addresses the withdrawal symptoms such as chills, cramps, leg cramps, nausea, sweating, anxiety. It helps with vomiting. Since it was originally used for alcohol, there was one clinic whose seizure rate actually rose when their patients were not on sleep tea mix. It's caffeine free. A lot of the trainers don't care that much for. I love it. I think it's I think it's very good with the NADA protocol. I think they go together very, very well. The recipe for this is 3 parts of the chamomile G to 1 part of everything else. However, there is a company out in New York that sells them. You can buy it loose and bag it yourself, or you can buy it already pre-bagged. It's caffeine free. You can use it throughout the day, either cold or hot. But then you can also use it as a sleep aid without having to wake up the next day feeling like you're hungover. I usually give my patients in any kind of, if I'm in a group setting or if it's just an individual setting, I will always give them at least 5 of them to try it out, and they love it. If it's too bitter for most people, because it does have a bitter taste, add lemon and honey. Do not add any artificial sweeteners. I would just, honey would be your best to sweeten it, and the lemon will cut back on the bitterness. Since I am also a certified functional medicine physician, I do a protocol through Dr. Charles Gant that's based on nutrition and supplements, and it's also I add the NADA protocol to that supplemental protocol. You can do either one by themselves, but together they're amazing. And that would be it. Anybody have any questions?
Yes, so this actually finishes our talk, and I want to say that Dr. Chester is going to start the classes soon with the CEUs available as well. This is just an overview of the NADA ear protocol. So if there are any questions, please let us know.
Yes, I have I'd like to also be doing another webinar on a pain management protocol, and it only uses the ear as well. It's got 5 points, and I used to teach at the acupuncture college. I was a biomed professor, but I taught auricular acupuncture, and this protocol was not taught to us. I just came across it on the internet, and I have used it ever since I read the research on it. If you do not offer this protocol to your patient for pain management as the very first thing, the very first protocol, then I consider that patient negligence, because it's the results are incredible. So I will be giving a webinar on that one pretty soon.
Yes.
Show you how that one.
Correct. So any questions, please? We apologize for the delay. Dr. Chester had a hard time trying to, technical difficulties, and
yes, I live way up in the mountains.
so we were delayed by almost, I don't know, maybe 17, 20 minutes or so. So please, apologies again. Yes, I see something. Okay. All right, so let me see. Okay, thank you for the interesting presentation. Thank you for being patient. And like Dr. Chester said, he will be coming with more presentations and also coming with the more detailed sort of like a classes that would allow you to take CEUs as well. All right, so before I wrap up, if there are any other questions, just want to wait for a moment. Okay, Dr. Chester, would you like to say something to end the session?
Yeah, I'm in the process. I haven't not been able to do any NADA seminars because of the COVID. So we haven't, because of the social distancing and not being able to actually touch people. So hopefully when this settles down, I give a seminar once a month. I've already put my application in with the NCCALM, which is the National Certifying Organization for Acupuncturists. Some states require that you be a member, some states don't, but you have to be a member at least once before you can get your license in any state. Once it expires, that's fine. Some states don't require it. I happen to live in a state that requires it to be renewed every 4 years. So I believe it's every 4 years. But I have submitted an application to provide my NADA seminar students to receive CEUs. There are a few registered trainers that do have that option, or that they're allowed to do that, and I was not aware of it. So a staff member told me, and so I have applied for that option to let people get CEUs for attending this seminar.
Great. And we will be sending that information soon. So, and please let us know about the session today. You can reach us at care@nourishtalk.com. Our website is www.nourishtalk.com, and like us on Facebook, and please give us the feedback. What is it that you'd like to see in future? How are we doing? We bring educational sessions for the end users as well as professionals every week. So check our Facebook page regularly. With that, I think I'm going to sign off. Anything else, Dr. Chester, before you want to say, or anybody else has a question before we sign off?
That is, I just apologize for my technical difficulties here. I'm not too real tech savvy, so we finally got it going, and I hope to have you join my next webinar. And
yes.
I hope that you can go to the acudetox.com and go under training, and you will find a list of people who are offering seminars, what dates and what cities and states. So just go to the acudetox.com and just go to the scroll down to scroll down to training, and you can find someone giving a seminar somewhere.
All right, but Dr. Chester would be coming back. So I want